Chiropractic for headaches in black and white. Now, there are a lot of different approaches to chiropractic. There's well over 300 different chiropractic techniques. The technique that is utilized here at Prior Lake Spinal Care is called NUCCA, which stands for the National Upper Cervical or Upper Neck Chiropractic Association. This is based on the premise that the top of the spine is structurally the weakest link, because with all of this extra mobility, there's less stability, as well as, number two, the neurological structures in the top of the neck are more important than in the lower back and down the legs and even in the mid-back, for example. And I think this is pretty intuitive. If you watch sports on TV, somebody injures their knee, it's a bummer, they gotta call a timeout. Somebody injures their neck, the whole stadium goes silent. And thirdly, the top of the spine is anatomically very unusual side to side. The skull, and sometimes what can happen is the joints of the skull are not perfectly shaped side to side. And that goes for the C2 surface as well, which is what C1 rests on. Now, C1 is called Atlas. Atlas from Greek mythology was that Titan that held the world on his shoulders. You might have seen statues of that before. And so what we know is that this big bowling ball, 13-pound head has to sit just so on top of that atlas vertebra. And if it doesn't, then the tissues that anchor into the base of the skull, they're called the suboccipital muscles, and they're part of the suboccipital triangle. You can see how those little muscles that attach the head to the neck are arranged somewhat like a triangle. When the C1 goes out of place, then those muscles get tight, and since there's a connective tissue attachment from those muscles that then goes in and anchors to the inside base of the skull, this can now cause tension and distortion to the brain tissue along the dura mater. Okay, so you basically got the brain, but then there's kind of a skin. My head's a good example. There's a skin, there's a lining of the brain that goes all the way down and lines the spinal cord itself. So with extra mobility, there's less stability. We need to be super duper specific in this area in order to give the best possible adjustment, the best possible correction in order to get you feeling better again. Now, I specialize in the top of the spine, but even here you can see in this more generalized chiropractic diagram, here up at the top it says headaches and migraine headaches correlated with that top vertebra not being in the correct position. So that's all we specialize here. We do it, and we do it well. Thanks for watching. Feel free to call or text anytime. We can do a consult over the phone or even via text message. Come in here, we can do a free consult. We want to take that next step. Then we can take the x-rays and do an evaluation. Of course, there'd be a charge for that. We would explain all that to you up front so that there is no surprises, and then pursue the appropriate course of action for you. Thanks for watching.